Okay, everybody, we're back for part 2. I'm really excited. This is going to be so much fun. Dr. Cassie Wilder sitting next to me again from Minneapolis Integrative Medicine. So exciting. We realized that we scratched the surface of like women's health. Like, I mean, like barely tickled it. And when we were leaving, I looked at you and I was like, we just got to, do you want to come over tomorrow and do another one? Because let me tell you,
we cleared my afternoon.
I know. I'm like, let's just do it. And you're like, yes, we're doing it. So this one is literally about hormone health because it's PCOS related, PMDD majority, periods, perimenopause, menopause, endometriosis, and I'm forgetting something. Am I forgetting something?
Pregnancy and autoimmunity.
Yeah, pregnancy and autoimmunity, which is kind of where we're going to start because I want to start with the more general questions and then we'll dive deeper into everything. I always put stories up to ask me questions or questions to my guests, you guys. And if you're like, I want my question answered about that topic, be watching out for what I'm having and who I'm having on, because I put on my story, hey, I'm going to do a part 2. This is yesterday. It's still up right now. And we're going to talk about these, topics that I just rattled off. And I'm not joking you. I got over 200 responses, like in under 24 hours, like because it's so prevalent. So I'm like, thank God we're doing another episode because
thank God you posted that.
Oh my God. I know. And I'm like, the direction is right there. I'm like, I actually have a lot of these questions and I don't battle with all of these things, some of which I will eventually, but I'm really excited to get you information and get into it. So just as a reminder, in case you're joining us and you did not listen to part 1, which I really highly suggest that you do, Dr. Cassie's specialty is in hormone health and thyroid disorders and helping patients connect the dots between symptoms they're feeling. You also work on adrenal fatigue, which we talked about in the last episode.
And female health and hormones.
And all the things.
They're all connected.
And Minneapolis Integrative Medicine is what? Can you give them just a tiny little blurb?
Minneapolis Integrative Medicine is my baby. We practice the best of conventional medicine and holistic medicine and bridge that gap between. We practice very deeply rooted root cause medicine, and we consider ourselves health detectives. We are very good diagnosticians, and we lead with diagnosis and trying to get to the root of what the issue is, because as we will cover later, if you do not know what the root is and you do not know where the imbalance lies, no matter what you do, it's not going to work.
Yeah, exactly. And bingo, mic drop. Okay, we're going to start with a few general write-ins just because I saw these come in and I was like, that's a really good question because I'm not even really sure. 2 people wrote in, they were like, signs that I have hormone imbalances that I need to get checked. And then things that we can implement to balance those. I know that's pretty vast and we're going to go about each of those questions more in depth, but what are some signs that you see?
Pretty high level. A woman's body, a length of a menstrual cycle, a period, is about 28 days. And it really is this like wonderful hormonal symphony of like estrogen, progesterone, testosterone, LH, FSH, just really moving in harmony throughout the entire month. And hormone imbalances is when one of those hormones moves in an excess, or down in a deficiency when it's not supposed to. So progesterone is created during days 14 through 28. I'm using that 28 day as like a textbook average where everyone is so different, but 14 through 28, progesterone is at its absolute highest. It relative to estrogen, it is way higher than estrogen. And if you've got some form of hormonal imbalance,
I also am literally like Stutter McGee today. So if you notice that, too bad, so sad, everybody. Who cares? And we don't care on here, by the way.
Great.
We're human.
If there is some sort of hormonal imbalance, you could have low progesterone relative to estrogen.
Yeah.
And when we pull that on blood labs, we are specifically taking it from a particular point in your cycle so that we can see that. And we know where, days 19 through 28, we know where estrogen is supposed to be. We know where progesterone is supposed to be, where LH, where FSH. And if you have imbalances, those numbers are going to look off relative to each other and relative to the time in your cycle that you are. What to do about it is very much going to be dependent on what is actually imbalanced. Something like high estrogen or estrogen that's not detoxing properly is going to be one thing. Low progesterone is going to be solved by a different issue. Okay. And even if you have those hormonal imbalances on blood labs, I would really, really still urge even pulling back and saying like, why is that imbalanced? My estrogen is very high. why is my estrogen high?
Yeah.
Is it because I'm being exposed to xenoestrogens? Is it because my progesterone is really low and it's not, providing that counterpart to estrogen? And really just, taking a step back and saying like, yes, my hormones are imbalanced, but why? Because very, very rarely is it just like the vanilla hormones are imbalanced and like we fix them up and you're out the door.
All.
Yeah. And that's all.
What symptoms are people looking for when that happens? Or like when there's imbalances, just in general, if people are like, I wonder if I need to go get a blood test, like what would even be the
easiest way for people when they come in to see what's going on with their hormones is something around your menstrual cycle, whether that's the 7 days leading up to it, you're having incredibly cramping, bloating. I have no problem saying people really get bitchy or snippy.
Oh yeah.
Or they're just really irritable, insomnia, that there's breast tenderness, PMDD, premenstrual dysphoric disorder, where you can get intensely depressed. And that's generally that 7 days before, or even like the first 3 to 5 days into bleeding is when people are going to notice it's going to have the easiest time noticing that their hormones are imbalanced.
Got it. Someone wrote in anything about PMDD that you can ask. Is there something you could cover? Because people are asking like, how do you even know if you really have it? Like, what am I supposed to be doing? Any information at all that you have?
PMDD is a psychiatric diagnosable condition. So it's definitely depression around right before your period to the most extreme level. And usually when you start bleeding, or like the next day when you start bleeding, the depression lifts and things are just like the sun comes out, right? The clouds part. And so general depression or general sadness or crying or just feeling really emotional is not necessarily PMDD. PMDD is clinical depression that gets much worse. And I think that PMDD really is the showcase of how your hormones are tied to your brain neurotransmitters, how intimately tied they are to serotonin, to dopamine. And if those female-based hormones are imbalanced, you're going to have imbalance of your neurotransmitters. That's going to create some of these thoughts and feelings.
Man, that's tough. I mean, any recommendations for people who have PMDD, or like what should they do if they're like, I think I might have it?
If you think that you might have it, I would first find some sort of accountability partner, or just tell someone. Okay. It doesn't have to, I would love for it to be your doctor, especially a trusted medical professional. And I know that people are really nervous to tell their trusted medical professionals because we are mandatory reporters. And we are, most of the time the conventional system is going to say, here's an antidepressant.
Yeah.
And I think people our generation and younger are not necessarily interested in that, especially if they don't feel like there's some form of plan to get them off in the future, or if it's not actually addressing the root cause. So I guess my first recommendation would be find an accountability partner. Tell someone if you're treating yourself and someone needs to know that that you are incredibly depressed before your period. The second is I love supplemental things. So that's generally what I do. I love evening primrose oil. Pretty high doses of EPO. I do it all month long. You could do like a smaller dose, days 1 through 14, and then really increase that dose from 14 through 28. I love anti-inflammatory diets for just about anything. So even thinking about limiting things like gluten and dairy and other inflammatory foods like sugar and caffeine. Even if you can't do it for 28 days out of the month, maybe you're doing it for 14, and you can really commit to being really good during that, and just like really setting yourself up for what's to come.
Okay. I love that. Those are like doable takeaways that I'm like, okay, I could do that if that was something I was experiencing. I love that. Okay. This one is an interesting one before we jump into a write-in. It says, is there a link between pregnancy and autoimmune disease? Like, can it trigger autoimmune? And I do have a disorder, autoimmune disorder, psoriasis.
Yep.
And I'm actually wondering this for myself.
1000%.
Really?
So we always say that the few times in a woman's life where she's at the most predisposed to getting an autoimmune disorder or her autoimmune disorder getting worse is puberty, each pregnancy, and menopause. And those are coincidentally the times in your life where you are having this huge hormonal shifts. Your hormones are just like, wow, when you're pregnant, they are high and they are hot and heavy. And then immediately after delivery, within a few days after delivery, those hormones plummet. And just that humongous shift, it will absolutely both trigger an autoimmune disorder and worsen any other. You had said psoriasis. I see clinically so much. I even screen, like I have a few patients who I've seen before their first kid, after their first kid, and before their second, and after their second. I'll screen them for Hashimoto's thyroiditis or other autoimmune disorders after every single pregnancy.
Really?
You can't miss it, especially since you're super young. Hashimoto's thyroiditis, I know, getting a little bit off the female hormone
that's okay.
piece.
I know someone that has this. I'm not going to out them. I almost outed them. I have to be very careful. I always have to call my editor and be like, can you please bleep that? I did not mean to say a name. But I know someone who has this and battles with this. Yeah.
It will completely, over time, over several decades, it will destroy your thyroid gland. Mm-hmm. And if you get this when you're 20, if you get this when you're 30, we're talking like 2 decades, 3 decades, you're still alive. You're still functioning. You're still good 3 decades, 30 to 60. You're still going in your 60s. You really want to know that you have it and start making the steps and taking the steps to prevent that glandular destruction.
Yeah. Oh my Lord. Is there a risk, just out of curiosity, that like, is there a link, I should say, between like, I have psoriasis now, and if I get pregnant, like something could advance? Or is it like, I know that psoriasis sometimes connects to arthritis, I believe is what
psoriatic arthritis.
Yeah,
you can get you can get psoriatic arthritis. And I would say yes, but also one thing that you should just know going into a pregnancy, and then especially on the other side, is you're like, I have an autoimmune disorder. That means that when I deliver, I really need to kick it into high gear to help tame my immune system and keep it what it can do. Yeah. I'm not going to recommend going on like immunosuppressants and other things, but even just thinking about what are some breastfeeding safe, what are some like postpartum safe things that I can do that will help to reduce these massive spikes and declines of my immune system. Like, what can I do to just like make it go up, plateau, and then come right back down? Like we want rolling hills.
Yeah. Instead of huge
mountains.
Spikes.
Yeah.
Mm-hmm. Okay, we're going to shuffle into a write-in that's going to drive us right into periods, and we're going to talk about PCOS, and oh my gosh, we have so many things to talk about. So I'm moving it fast, not in a bad way, just to like make sure we hit everything.
We have so much.
Hence episode 2 that we're here for. So my God, and we decided we're probably going to do an event. So I mean, like this is like, we have so much to do. Okay, so this one says, it's titled On and Off Birth Control, What Do I Need to Know? I have been on and off birth control for many years. What do I need to know now that I am engaged and maybe thinking about having kids soon? I started on birth control in 6th grade because of my acne, and frankly, my mom was embarrassed because of my acne, a whole other story. I was horrible at taking the pill because I didn't remember to take it all the time. I had never taken pills daily at this point, so I wasn't disciplined, and since my mom wanted me to be on it more than myself, I wasn't motivated to remember to take it. There were many times I flat out stopped taking it because I was embarrassed to tell my family I needed a refill, etc., or it was hard to get access to it in college. I went on the Nuva ring for 6 months and gained a ton of weight, so I went back to the pill. My periods are heavy and painful, but the doctor said I could switch meds, but I can't up the dose because I'm on the strongest one. Even now, I take the pill for 2 months straight, skip my period 2 times in a row, and then have my period. So my 1-year prescription ends early with me skipping my period. I have tried telling my doctor to tell the pharmacy this so I don't have a lapse in meds, but it never works. And without fail, at the end of the year, I'm off the pill for a month. Now I know this is a very specific scenario. I'd love to know if I should just quit the pill or if it will mess up my body or my ability to have children. I am now 26 and engaged to the world's best guy, meaning if we get pregnant, it's okay, but not ideal. Open to all the advice here. Thank you so much.
So if I have a patient who is choosing to come off birth control, I know this is kind of an example where she's not necessarily choosing, but if I have a patient who's choosing to come off birth control, I don't actually run their hormones for a minimum of 60 days. I like to go 90, or at least until they've had 2 full cycles after that. So I would say if it like some fears around like screwing up your body and your fertility, I think are not there. Okay. I would not be afraid. I feel really good about, having to be off of it for a month. And if you restart it after another month, it'd be perfectly fine.
And that pattern's okay.
That pattern's fine.
Okay.
Yep. There are certain birth control pills that you actually will take continuous for 3 months and then go off of it for 7 days, have a bleed, and then take it continuous for 3 more months. Yeah. So not terrible. I would say in terms of getting off of birth control and fertility, I think one thing that we need to remember is that the egg that you are ovulating today has been maturing for the last 90 days. And so even thinking about getting off of birth control and then getting pregnant, the day that you stop and that reestablish, it'll take a little bit for that reestablishment of that brain to ovarian connection to start maturing a follicle, and then for that follicle to actually be released. And then that release of follicle is ovulation.
Yep.
In most cases, does not happen right away. I hear it all the time. I stopped birth control, immediately got pregnant in like 14 days. And
Yes,
there will be people. I have a friend who I swear she just thinks about getting pregnant and she can get pregnant. And
That's
so
crazy.
I know you can't sneeze around her. And so there are all sorts of women on this planet. And so I think with getting off of birth control, if it's I'm getting off of birth control and I'm considering getting pregnant, giving yourself that 90-day window of saying like, I'm going to get off and we're not going to do anything. We're not going to try. We're not going to risk it, et cetera, for 90 days, because you really want that follicle that's maturing to have really good nutrient density and nutrient supply.
Yeah.
You want to give it proper like hormonal stimulation from your own intrinsic hormones. And you also want to give the DNA the best chance to having really chromosomally healthy, little guy, little pieces of your follicle. So
Can I ask a random offshoot question with this related to this? Is there any correlation with like a miscarriage happening when someone gets pregnant immediately after getting off the IUD or birth control, and like getting pregnant like within a minute, and then maybe like having a miscarriage not shortly long after that? Could there be a tie?
There absolutely, like, common sense could be a tie, because one thing that birth control does is almost completely suppress your endogenous hormone production, and really getting that baby past 6 weeks up until that 12-week mark really requires the female hormones to be up and running and on point and really supporting that implanted egg. And if you've been on birth control for, Mirena is 5 years, it's 7 years now. If you've had that IUD or that birth control pill for a long time, you're kind of asking your body for hormonal support that it doesn't really have. So it would make very much common sense.
It could be linked. Interesting. I just had thought of that and I was like, wait a minute, I wonder if there's a link there. Okay. Well, by the way, thank you for writing in. I always say that. Appreciate you and sharing your experience, and we're here to help. So it sounds like you're going to be just fine. You're okay with your patterns. I had always wondered that too. If you were irregular with your pill taking, if something was going to happen, or
you have an increased risk of pregnancy, it decreases your efficacy of the birth control
for sure.
Yeah.
Or if you're jumping from IUD to pill to that's a different spike in hormones. I'm sure, depending on the type.
Yeah.
That can be a little disruptive, probably.
I know that it changes your efficacy in terms of the hormonal suppression and the change that it happens on your ovaries and in your brain. It takes longer than a day or two.
Really? Okay. This is a question. Why is my cycle 40 days long after getting the IUD out? And I had a few talk about, IUD weight gain, for instance, when it's on the way in, all these different things with those hormone spikes. But the 40-day cycle was the one that stuck out to me after getting the IUD out.
It depends on what IUD. If it was the copper and it's non-hormonal, that would be very weird that you had a 40-day wait. If it was a hormonal IUD and it got it taken out, kind of back to that, you've really suppressed your endogenous hormones for a pretty long time.
Yeah.
And you have to give it a little bit of time. It's kind of like puberty. If you remember starting your period, most people don't remember starting their period unless it was extremely painful. There you go. The regularity of it. No one really remembers it came every single month and it was this. You remember the qualities of it, but usually what happens when someone is new to having their menstrual cycle, it's a little irregular. It could come every 6 weeks and then 4 and then 8, and then it can be pretty irregular. Same thing with kind of getting your IUD out, your brain and your ovaries. One thing that women are not properly informed consent on is that birth control actually changes the communication pathway between your brain and your ovaries, telling it not to ovulate on a regular basis. And so getting off of hormonal birth control requires that reestablishing of communication between your brain and your ovaries. And that definitely doesn't happen overnight.
No, definitely not.
So even in a 40-day time frame, ovulation is the only time that will actually kick off a true period. I hear people quite honestly talking on birth control. They're like, I get off of it for my placebo week and then I have a period. That's not a real bleed.
Oh, it's not.
No. Estrogen is thickening that lining of the uterus, and then going off of the estrogen for the 7 days of a placebo week is just allowing that uterine lining to shed. It's actually not a period.
It's not a period.
No, a period medically can only happen after ovulation. And so on a birth control pill, and on most IUDs, you don't ovulate anymore. And so you're not actually having true periods. And so
didn't know that.
Yeah.
Didn't know that. Had no idea.
We talked to about in PCOS where you can go, I had patients like every 6 months sometimes not get a period for like 6 months, but they'll get these random withdrawal bleeds. They'll get like a spotting, or they'll get a couple of days of like really, really light brownish blood. And that's what we call a withdrawal. Your body's hormones have just changed for the day during the time. Maybe it's stress, maybe it's food, maybe it's sex. Something happened and your body said, we're just going to shed some of that. And it's not a real period. It's just blood coming out.
So spotting randomly isn't really like risky if you're on, let's say, a form of birth control. Like there isn't something to be said about that. Because I had a few write-ins that said bleeding randomly. Where is this coming from? Or spotting randomly? It's not context driven because I don't know if they're on birth control or if they're off birth control. I just know that they're asking like if let's do both. Like if you're spotting regularly, or excuse me, if you're on the birth control pill and you're just spotting or randomly bleeding.
That can be normal from like the withdrawal bleed aspect of it, that you've suppressed your own, and especially something like a progestin-based birth control where it's Mirena, or another progestin-based birth control, you can have, it doesn't necessarily suppress your endogenous output of estrogen. So you can still have higher levels of estrogen, and actually that endometrium can still thicken. You can have weight gain from estrogen. It actually helps tell your excess calories to deposit some of that into your adipose tissue. It has that little fun mechanism.
Yeah, because that was another thing. People say IUD weight gain, or like hormonal weight gain after getting on birth control.
Yep. Typically the estrogen aspect of it, because women are really good at making estrogen. Mm-hmm. Estrogen can be made by the ovaries, the adrenals. It can be made from conversion from testosterone, which we had talked about in part 1, can happen from the ovaries, the adrenals, and the conversion of DHEA to testosterone. And then that can go straight to estrogen. Some people are really good at doing that, and most women are pretty good at doing that. And so all of that estrogen can change your appetite. It can change we talk about like the HPO, the hypothalamic pituitary ovarian axis. Estrogen can go to the hypothalamus, which is like the master of your brain, and can change appetite. It can change your like metabolic set point. It can tell hormones to take the excess calories and put them in your fat tissue. It can basically take over your brain. I also don't want to demonize estrogen. Estrogen is wonderful. Yes. It is the reason you have really supple, soft skin. It is the reason why you have vaginal lubrication. Mm-hmm. It is the reason why you can have, it's just,
it's got a lot of positives.
It has so many positives.
But she can be a little
bone health, brain health. She can be a little mean. Yeah. I mean, can't we all? But she can be a little mean.
I feel that. You know what I mean? It happens. Like, I get it. How about acne coming on after coming off the pill?
It depends on what you were like beforehand. If you were really acne prone and went on it for acne, one thing that birth control doesn't do is treat any sort of root cause. And so you're kind of just putting yourself in a little bit of a hibernation, and then whatever comes out the other end is probably back to what you went in on. And that's where you really just want, which is also fine. I want to validate anyone's experience that are like, I am in such a bad depression. I'm so anxious. I can't go out in public. I can't get a job. I can't even like think about dating. I can't do anything because my acne is so horrendous. I need a quick fix. Do it. If you are properly informed consent, that is your choice, do it. But just know part of that informed consent is when you come off of it, I need you to be in a better headspace, a good mental health space, a good job space where you can take back on this project because it is coming back.
Man, I don't even know that I was on my normal periods long enough to know that that was going to happen to me. I got off and I got some like random birth or acne after coming off birth control, and it was really weird because I don't have acne, and I've never had acne. And then I got off birth control after getting on it literally probably after like 3 periods. And I was like, whoa, what's going on here?
Those things are pushing through your system. So the other part of it is you got on it really young, which means that your exposures in your environment to xenoestrogens, to antibiotics, to heavy metals, to mycotoxins, to stress. Your adrenals were probably much different at 14 than they were at 26. I can't remember exactly the age ranges. But then you come off at 26 and your liver is in a much different place than it was at 14. Like you probably consume alcohol, maybe, you are exposed to different things. And so you're completely different person than you were, and now those hormones are having to detox through almost a completely different body.
Man, another write-in that was very common, because we're talking about hormones and we're talking about leveling them out. It was, will my period and my hormones ever level out? And this is a ton of people wrote in saying like, I got off IUD, now I've got intense period, mood swings, heavy bleeding, but I feel better off the IUD in the other parts of the month. I hear a lot of like different things like migraines, my personal experience is like, I had painful periods when I got on. I had painful periods when I got off, like a lot of blood. I literally bled through my pants in LA when I was there like 2 weeks ago. Yep. Ooh. I didn't realize that I had a tampon in that was probably, I needed to I didn't wear one to bed. Yeah. Put one in the morning, standing up, running around, wearing white pants. What the heck? And then on the plane. Yep. I went to the bathroom and I was like, oh my God. Okay. Yep. And the worst part was the man sitting in the seat, like next to me. He did the thing where he puts his legs over to the side, like when I'm trying to walk by. And the first time I had people behind me and I was like, oh, okay. And I just walked past him really weird. Like my butt literally has to go in your face. And the second time I was like, you can get up. I literally said that.
Good.
No, don't be a weirdo. Don't be rude. But backaches, headaches, I still do. I don't not used to, but still have 2 full days of feeling like maybe everyone hates me or I'm going to lose my job. That's another fun little thing. But I too wonder, will things balance out or is this the balance? You know what I mean? And that's why I came to you guys too. But a lot of people have same experiences with intense periods after, getting off this birth control.
Because what you're describing is incredibly intense and incredibly not normal. And I think that with those hormonal fluctuations, we can expect and we can anticipate some level of symptom changes. I personally I'm going to get so much hate for this. I've really never had really incredibly horrible periods. I think my first period after my first child was probably the worst period I ever had. I would consider myself normal. Yeah. And I think that's a really good experience for me to have though as a clinician, because then I know what I can set my expectations for my patients.
Yes.
So we'll just talk about mine then. Is for normal, I get a little bit of breast tenderness. I honestly I can touch them, I can move them, I can have sex, I can do whatever, but they're a little bit tender, and I know that it's coming up. Day 1, I get a little bit bloated. My abdomen feels a little bit warmer. My uterus, it feels I don't know, how do you say your uterus feels tired?
It does feel tired though.
It kind of feels heavy or tired. My pelvic floor kind of feels, maybe that's post kids, feels a little bit heavy and tired, but nothing else. I don't get migraines. I don't feel immensely sad. I probably get a little bit more anxious than I usually would, or maybe I will have thoughts that things are way worse than they probably are. But I would not consider myself abnormal. And I hear these stories like yours and I'm like, holy shit, that is abnormal.
And a lot of people wrote in with similar same period or, period experiences.
Yes. So I would say to the question of is this your forever? Absolutely not. Do I think that we can expect every single period to be magical? And where, you've probably seen the crazy videos where they're smearing menstrual blood on their face and prancing around fields and gypsy magic. If that's your vibe.
If you can do that, great. But I don't want anything to do with my period blood after it exits the body, please. Thank you. Leaving it in the toilet.
I'm good too.
I'm good. No, totally good.
We had talked about the interesting like things that we see and that people that we encounter, and like, yeah, that's just
you're like, oh, okay. All
right. I will say though that things are always going to shift and be different.
Okay.
So, maybe if we're talking like on the spectrum of normalcy, I would expect my patients to get back down to like normal. I would not expect there to be it'd be silent. Like it's like, I have no symptoms, and then one day I wake up and I bleed, and it's like that to me is like maybe you're the 1%, but periods throughout your life. Mm-hmm. So you can imagine like intense 90 days, intense quarter at work. Your periods are probably going to be worse than what they were the 90 days before, where you were like meditating every morning and having a wonderful time. If you go on vacation, we won't talk about going to Europe because like I felt great drinking European wine.
I'm sure you did.
It's so different. But if you drink
free,
if you drink really shitty wine for 90 days, your periods are probably going to be worse. If you eat a ton of sugar for, you just kind of go on this bender of booze, bad booze and sugar and all the stress and all the things, your periods are going to be worse. And what we know is that is because you're affecting the quality of your follicles and you're affecting the quality of that ovulation. Because a really healthy, good follicle, when it ovulates, can make its own, all of them do. They make their own source of progesterone, but it'll be higher. It'll be better. And so right after day 14, the follicle makes the progesterone itself. And then it probably takes between like day, 18, 19, day 28 for you, the female, to make more than what the follicle is making and kind of keep up with that. That's why you get where it goes like up at like a slope.
Yeah.
And so you can imagine that at different points of your life, being exposed to different things is going to change that follicle quality, change your hormonal output after the follicle has been ovulated, and it's going to change that progesterone value. It's going to change the estrogen values, and you're going to have different symptoms. So I would say as long as we're still talking in like the normal limitations, as long as it's like, yeah, I was an asshole, of course, this is why. If it's like out of the blue, you're like, wait, where was that coming from? That I did not deserve that, then yeah.
Okay. So coming in would probably be a good idea to help balance the hormones.
Yes.
Which is why I'm with you guys. I would say they've been better even just since like doing some very simple things.
Yeah.
But they're on their way. You know what I mean? They're shuffling. It just takes a little bit of work. You're like, oh wow, I thought I was totally good. Is there such thing as normal PMS symptoms?
I would say the normal PMS symptoms are probably the ones I was describing for myself, like the light breast tenderness, maybe the little bit of moodiness, but nothing that is like I'm about to like murder my husband. Yep. I can't go to work today. I'm having intense, like if it is affecting your activities of daily living and your happiness in your life, it's not normal.
Okay. That's good to know. And I think a lot of people need to hear that probably because we think we normalize so many things that are not normal and it's not okay. And even me, I was like, well, yeah, I guess that's that. I got bad periods. See ya. That's all I know. It's like, no, I'm not living with that anymore. Somebody wrote in talking about the color of the period blood and what it says about our hormones. That's my last period question. Then we're moving into PCOS. So what would you say about the color of the period blood and what that says? And now that we know that we're not having periods when we're on birth control, it's just a little spotty situation, but keep that in mind, people.
Usually really dark periods are going to be estrogen excess. And I say the words estrogen excess, and I actually rarely see it be estrogen that's way over the limits of the lab. When I talk about estrogen excess, I'm also talking about it in relation to how much progesterone you're taking how much you're making, because remember I said you want those to be relative to each other.
Yeah.
I rarely see estrogen way over the top, way over the limits of what I want it to be. I have seen it, but it is not the most common. So estrogen excess in either frank estrogen excess or in relation to how much progesterone you're making is going to be usually like clotty and viscous and thicker and really dark. And so, yeah, usually that's kind of, and you can have micro clots. You can also have larger clots. Clots over the size of a quarter are considered abnormal. And then usually, like spotting before your period is going to be low progesterone. So if your progesterone, we had talked about, it goes up in a slope and should last until day 28. If it doesn't last until day 28 and it starts to tank even sooner than that, that will start to signal some of that withdrawal. You might get some spotting. So that would be a signal of low progesterone. And then really light, really light, really bright blood is typically like light volume is typically low estrogen. And even young people can have really low estrogen, especially people who are coming off of birth control. You can have low estrogen, especially if your hormone was completely suppressed. But yeah, I've not ever seen it be like bright red blood like you would see it coming out in like a phlebotomy. Yeah. But it should not be dark and viscous, and like you shouldn't look at it and be like, that's nasty.
That's gross. Yeah. Good to know, because then people have things to look for and then maybe come see you, or like, there's something to do when you see something that's abnormal. Like you should go do something. Like obviously you could probably recommend some supplements if you have low estrogen or high estrogen or low progesterone.
Sure. But knowing that first,
figure that out.
I would say too, if I could have like 1 second, it's going to be that I know that obviously I feel so strongly that people need an advocate for their health, and I would love everyone on the planet to come see us. And I know that that's not always the case. So one thing I think you can do at home to kind of see where you're at is basal body temperature testing. Yeah. So like your Oura Ring does it. It uses natural cycles, which is an app that you have to buy. So some people don't want to pay the extra money.
$5 a month.
Is it $5?
Sure. I don't know. I don't remember, but it's been worth it for me. 100%.
Totally. It's
100%. And people ask me all the time. It is 1000% worth it.
Yeah, I would agree with that. You can also take a temperature. Like you can buy like a $10 BBT specific thermometer on Amazon. Before you get out of bed in the morning, put it under your tongue and then look at what the number is and then write it down. They have apps, or like Daisy has a thermometer that will then just like hook to your phone. There's Temp Drop, which takes like the temperature from the back of your arm. There's so many of these different apps that can measure your temperature in a basal body method. And what we want to see is after ovulation ovulation happens when your temperature goes up 1 whole degree. Or as close to 1 whole degree. So if it was like 0.9, I would say, yes, that's an ovulatory spike. And then we want it to maintain. We want that level to stay high throughout the entire luteal phase and then tank at the very end. And that's your signal to then bleed. And so if you're like, I want to start working on hormones, I can't afford labs or I can't afford a doctor, I would 1000% do BBT tracking. And then if you're going to do something to support your hormones like Vitex or even something like seed cycling, you can measure efficacy with BBT testing. I'll even have patients where like we're not doing labs every 90 days, or even like 120 days. And I'm just looking at their BBT. I'll be like, pull up your Oura Ring. Let's look at it. And your temperatures got up to 97.1 last month and now it's 97.5. Great. We're calling this measures of success. So I would definitely recommend that.
Okay. That's really helpful. I like that. I'm like, now I'm like, I need to be paying more and more attention to my Oura Ring already than how much I do. And I'm like, always like, how did I sleep? What did I do? Oh, that's a whole nother battle. It's like, I'm trying to figure out, why am I not, I think it's that I don't REM, but I deep sleep. I do REM, but not quite as much as I should be.
You don't have the 4 to 5 cycles per night?
No, but I'm deep sleep, but then my REM is just always like a hair shorter than it should be.
Yeah.
Which is really weird. I'm like, why? Interesting. More conversations to be had, my people. Okay, so we're going to shuffle the PCOS because I want to give time for these people. And I don't personally struggle with this. I'm blessed that I don't, but I know that a ton of people out there, it's very common. A lot of the things that we talked or that were written in were about just like lifestyle methods for someone with PCOS. Yep. What does that look like?
So I think,
and what is it?
Yeah, I was like, maybe defining PCOS is going to be polycystic ovarian syndrome. It is a spectrum disorder. You ask any older-ish OBGYN or, women's health practitioner, they're going to say that the textbook and what it has to look like is hyperandrogenism. You have to have a female who's growing a beard. You have to have this string of pearls on ultrasound that shows that there are, cysts there from unruptured follicles, and you need to have insulin resistance. And this person needs to have a large abdominal weight gain. And there is this picture in a textbook where you will see those people. If you saw the picture in the textbook, you could recognize those people. I can tell you that 9 out of my 10 of patients do not look like that textbook, and they have either raging PCOS or that they just don't, they don't look, that's not what they look like.
So
and
misinformation for a very long period of time.
I think that now we're discovering that there's a spectrum, that people don't always have to look like that to have it. And by telling people that they can't even have some form of gray area of PCOS, I think it's hurting our fertility, quite 100%. Honestly. They're not getting the help they need. So PCOS is an ovulatory dysfunction where we had talked about ovulation. It is when you ovulate, hopefully 14 days later, you have a cycle. PCOS patients ovulate at random intervals. They might ovulate, every month. They might ovulate every 3 months, every 6 months, every year. They might not ovulate at all. And so they have an ovulatory dysfunction. It can be a multitude of reasons why someone might have that dysfunction. Textbook wise, usually they're looking at hyperandrogenism, so high levels of testosterone, which inhibits ovulation at the ovarian level.
Okay.
Or insulin resistance, which can also disrupt follicle quality and disrupt ability to ovulate. You also have to go one piece upstream, and remember that your brain controls ovulation. And so we're also looking at what other factors control your brain and your pituitary based hormones. And so I know now a lot of good gyns and women health practitioners are changing the way that they're screening people. It doesn't have to be so rigid in your diagnostic criteria. And we can call you PCOS-ish, and we can call you PCOS on this grayscale spectrum, and really help you.
That's good though.
Yeah, 100% it's great.
What lifestyle changes are people making, or should they be making if they find out they do have PCOS? What should they know?
I think the easy ones to touch on are going to be the blood sugar regulation, is really looking at your blood sugar and how you eat in a day and saying, okay, we really don't want those vast ups and downs. We want the rolling hills. We want you to be fed. We want your glucose to come up. We want it to go back down after a period of time, and then fast for a bit and then go back up. So really looking at blood glucose control and making sure that it is consistent. If there's one thing that your body wants, it's consistency. If you've ever felt yourself out of a routine, or you felt yourself out of, whack, it's probably because of lack of consistency, and your body feels that.
So literally just eating at normal time, times with a little bit less sugar, ideally.
Correct. Yes. And looking at how much, net carbs or even net sugars that you're getting in. One thing I love for PCOS patients is going to be CGMs, is the continuous glucose monitors.
Oh, the one on the back
of your arm. The one on the back of your arm.
Yeah.
I'm obsessed.
I want to do one of these.
You have to. I love them. To me, I love this personalization of I eat this food and this is what it does to me, because you will not believe that I had a man, he was pre-diabetic, and he would go, he would jump out of helicopters and go skiing in Park City. He was the most fit man, and he would water ski in White Bear Lake. He was the fittest man, and he was pre-diabetic. And I'm like, how the hell are you pre-diabetic? You probably eat healthier than I do.
Yeah.
I made him do a CGM. He did a CGM. Tomatoes. The man was eating tomatoes out of his garden, and it made his blood sugar go on a roller coaster, and he ate tomatoes for so long, he was pre-diabetic from it.
What the hell? Tomato.
You would never guess. And so CGMs really give you that ability to say, wow, for you Tomatoes make your blood sugar go crazy. For you, sweet potatoes make your blood sugar go crazy. For everyone else, or for a group of people, maybe they can handle that. They can have some sort of tolerance. But CGMs really give you that ability to really nail in what it is and dial in what it is for you.
Never heard anything like that. I'm like, the tomato out of all things, like Mr. Healthy over here.
Yep.
What supplements can somebody be taking for, PCOS and to help manage it or to help manage symptoms outside of regulating your eating and your glucose and your carb intake and sugar?
Some of my favorites on like a really general, I will say also that if you are not hitting the mechanism of the root cause of your issue, nothing that you do is going to work. So if you find yourself in this place of like, I've been trying this protocol for an entire year or for 2 years and nothing is working for me, it's because the mechanism of action that is going wrong is not being hit by the supplements or medications that you're taking. So on a general level for PCOS, we're looking at myo and D-chiroinositol. I love this both for like an anti-inflammatory and blood sugar control in a supplement. You can generally find it in a powder and it tastes really good. Okay. Or it tastes really good, meaning like it tastes like nothing.
Okay, perfect.
In like the natural supplement world, if it tastes like nothing, it's good.
And it tastes like, if it tastes like yummy, it's probably not
probably
good
bad for you.
It's probably got like ascorbic acid or something in there. That's like, why is that in there? Yep.
For PCOS, I also, I love things that are going to help lower testosterone levels. You don't always have to go the lowering testosterone levels. You can go in like the testosterone conversion to DHT. You can go the 5-alpha reductase inhibition route. So thinking like pumpkin seeds, saw palmetto, EGCG, which is one of the active ingredients in green tea. Those are going to be really big fan favorites. And I also love berberine. So berberine, if you look on the back of a supplement bottle, you'll find a bunch of herbs and then it says contains natural containing berberines. That's not what I'm talking about. Okay. I use those for more antimicrobial. We're looking on the back of the bottle and looking for berberine HCl.
Okay.
And berberine works similar to metformin, where it can help to regulate glucose control from the liver, and can be really helpful for PCOS patients.
Yeah, that's great. Those are all very tangible things. I'm like, I love a tangible thing. People always write in, they're like, yeah, that's nice. I can go do that right now. I get it. I hear you. Is there a fertility effect on PCOS and is it curable?
1000% there is a fertility effect, because if you're not ovulating on a regular basis, ovulation is obviously how you get pregnant. You ovulate, you fertilize that egg hangs around and it becomes a baby. Right. So if you're not ovulating on a regular schedule, it can be hard to know when to have sex. I guess I guess like the problem solution to that is just like have sex every single day.
Every day.
Multiple times per day.
I don't know why, but that doesn't sound super great for me. Like, no, I mean, we get older and I'm like, oh, too many times there's such thing.
There is such a thing.
Every day, like on the clock, I'd be like, okay, I want to take a nap. Please get away from me.
Yes. So, it really does impact how, like when you know to get pregnant. I don't want to use the word cure. I want to use the word can control really, really well, to the point where you don't even know that you have it anymore.
Wonderful. I
think that if you let hell loose again, you will probably revert back to this natural steady state. But I do know, and I see that you can get to a point where I think, actually I'm going to retract that. The cure to PCOS is menopause.
Really?
Yeah. You don't ovulate in menopause. So you really don't have PCOS anymore.
Yeah, true.
Yeah.
But ideally, if you're wanting to have children and you have diagnosed with PCOS, it's not a end all be all. You can do the symptom things and you can, like change your health and, regulate all the levels that you need to regulate that you talked about. And ideally you'll be able to have a little kiddo. And
I want to say too, like, I know that a lot of patients who do have fertility are really baby making on hard mode. I mean, we can see in our society a huge group of women who are spending money and time and emotions and effort, and like, they are doing this on hard mode. So I would never sell anyone a quick fix, and I would never sell anyone an easy solution, because even if I give you some work to do, it's gonna be work.
It's work still.
It is work. And like, you are already working really hard. And so to even sign on to a team like ours for something like that, it's going to be work too. And I will be the first person to give you a huge hug and just like validate.
It's a battle.
That
it's really hard.
It's a battle.
I mean, this next thing that we're going to go into is endometriosis. So I'm going to read this right in. And I think that they're both extremely difficult things. I know someone that's struggling with this too. I actually know multiple people, and I think we just need to give a little love to our crew out there that's doing this. So this one says, I've been diagnosed with endometriosis. What now? Do you have any advice for having endometriosis at 24? My doctor currently has me on 2 forms of birth control. It says an IUD and a Yasmin birth control pill to help me with endo symptoms and prevent cysts from growing. Previously, I had a 10-centimeter cyst that was surgically removed. I can never find any information about other people being on 2 forms of birth control. Is this normal? What should I be paying attention to in my body? So far, I've been on both medications for 1.5 years, and it has been helping with endo pain. However, I feel very anxious and my sex drive is completely gone. Is it reasonable to ask for something else, or are there other opinions for me? It seems like there isn't a lot of information out there with endo, especially pertaining to my specific situation. Any advice or information or guidance is extremely appreciated and helpful.
Endo is hard.
Yeah.
Endo is a hormonally driven condition, but it's not necessarily the hormones that are causing it. And so there's 2 leading theories for endometriosis. One is it's congenital. When you were being created, some of the endometrial tissue from the inside of your uterus migrated to other areas, attached to bowels, attached to, bladders, attached to other organs in your body. And then the other theory is retrograde menstruation. So that actually at that time of the month when blood should be going out through your cervix and out through your vagina, some of it's going backwards out through the fallopian tubes and into your abdominal cavity. And in your abdominal cavity is your bowel, is your bladder, is all the things. And so you would treat them kind of 2 different ways. So I'm going to go based on probably the more common one, which is the retrograde menstruation. And the really difficult part of it is that as soon as that endometrial tissue gets into the abdominal cavity, you have an immediate immune system reaction against it. Your body sees it as a foreign invader in a place where it should not be, and will create a whole systemic effect.
Yeah, it's like we're all going to attack this thing.
Yes. And as that endometrial tissue gets implanted and it starts to grow, because I said it's hormonally driven. And so then it has its own estrogen receptors. It has a lack of progesterone receptors, and your own natural estrogen will go and touch and stimulate everything, and it'll stimulate that. And so it gets bigger. And so this is an area where I'm not plugging birth control. I will just say it's a pro of birth control, is we're suppressing all that endogenous hormone production. And so you don't have that same estrogen to go and stimulate and grow that lesion. And so it's weird that they're on 2 forms.
I know.
I mean, quite honestly.
It sounded weird to me right off the bat. Yeah. I was like, oh, I don't know that's positive.
Yeah, that's really odd. That one form isn't controlling and hormonally suppressing. Yeah. So I would definitely talk to your doctor or someone about that. But with endo, it's so multifactorial that you have to look at the hormones. You have to look at the immune system. You have to actually look at the gut. And you also have to look at, if we can be really gross, the entrance to your vagina and the entrance to your anus are pretty close. And if we're talking about retrograde menstruation, you can have bacteria from your gut get into your vagina and get into your menstrual blood and backflow into your abdominal cavity. And they can actually find the aspects of the vaginal microbiome and vaginal of the gut microbiome on these endometriosis lesions. And depending on the type of bacteria that they find, their gram-negative bacteria can create a cell wall, which is made out of lipid polysaccharides. And that LPS layer is more inflammatory than just normal. And so you really have to look at the vaginal microbiome. You have to look at the gut microbiome and treat those as well as doing everything else. And then the hard part is that this patient's in so much pain.
Yeah.
And so you also look at them and you're like, okay, how do I give you a Band-Aid so that you can stand upright and that you are not in so much pain? Because there are many endometriosis patients who choose to be off of birth control because of multiple effects or just
absolutely.
A multitude of effects. And so you really have to take a step and say, okay, what are we doing for pain control here? Because if you're not going to be on birth control, which is fine. I'm not gonna plug it, but it can help with the pain control aspect of it. What are we gonna do for pain control? How are we gonna help you with that? And because this is gonna be a process and it's gonna take time. And those lesions, your uterus has progesterone receptors. So like taking cyclical progesterone in a form of HRT can help calm the uterus down and create some like harmony with the cramping aspect of it, but the lesions don't have progesterone receptors. So your estrogen is still going to grow the lesions. It's just going to help. The progesterone might help with like your uterus and the cramps that are being caused taming those. And so kind of like, looking at it from both sides. But those lesions are also going to create scar tissue. They're not supposed to be there. So if we're talking like your fallopian tube's not directly attached to your ovary, there's a little bit of a gap there. But if it's getting onto your ovary, it's going to create scar tissue, and it's going to create areas on your ovary that are no longer able to expel a follicle from it. So you are losing some of your fertile capacity with those endometriosis lesions on your ovary. And so that is also, and I hope I'm not plugging birth control for this, because I
no,
really,
you're not. You're just giving the options.
I was going to say, we don't
support.
It's everyone's personal choice. But if you aren't bleeding and you can stop someone from bleeding that has endometriosis, you can save some of their fertility capacity, because you're not getting that endometrial tissue onto the ovary. And so I have seen patients who will stay on birth control until they're ready to get pregnant. They will come off of birth control. They will try like hell to get pregnant, and then they'll go back on it afterwards, so that you're not worsening those lesions. And so that is definitely one option.
So, I mean, a lot of the how it works and all of these things, and obviously you'd want to check your fertility levels if you find out that you have endometriosis, which I'm assuming is through an ultrasound.
Ultrasound or MRI.
MRI.
There is a gyne out of Canada who is doing more diagnostic findings for ultrasound guided diagnostics for endometriosis, because currently it's really hard to find it. Like there's you're supposed to have a chocolate cyst on your ovary, and that is like telltale sign that you have endo, and that's just it. The likelihood that you'll see that is so low, unless you have really bad endo. But this doctor out of Canada is working on other ultrasound options for endo diagnosis. I personally, if I have a patient I suspect for endo, I send them straight to MRI. Yep. I don't even get it.
Yeah, you just want to look at it.
Yep.
What can they do to like help all of this? Obviously we said birth control, but like, is there, there's probably no magic supplement, when you have it, you just have it, but it's, what can someone be doing for their well-being to support, like maybe making the symptoms less worse to double negative, but just better.
Yeah.
Life better.
Estrogen in particular increases prostaglandins, and prostaglandins are what really, you probably know, like Pitocin. Pitocin's a prostaglandin that makes you, well, maybe the listeners do. It's what, like for labor induction.
Okay. Oh yeah. Yes.
Yeah. And
yes.
it can create that abdominal cramping, and estrogen does that as well. And so even working on hormone, I'm not going to use the word detox in like what you conventionally think of, but hormones in general go through detoxification processes through your liver. So enhancing that and helping support that go through, you can lower your prostaglandin amount. You can also make those prostaglandins, they detox as well. So you can push them down that pathway out of your system.
Okay.
That's going to really help with cramping. Estrogen is kind of one of the biggest drivers behind that. I would say looking at endometriosis as an autoimmunity, and even things like LDN, which is low dose naltrexone, looking at things like plant sterols is going to be really big at how do we control this immune system and make it so that it's not going crazy.
Okay.
And then I would also look at progesterone, because like I said, progesterone really is like that, it creates that harmony and is that cooling, calming presence towards your hormones, where estrogen is very like hot and fiery.
Yeah. Can you find that in like teas and
progesterone?
Progesterone. Where can you find that? I'm not even sure.
Yeah, progesterone, Vitex berries is probably one of the better known ways of supporting your progesterone values. And I'm generally looking at like 500 milligrams a few times a day, or taking it all at once. So that is commercially available at Whole Foods or any of the co-ops. You can find Vitex berries in teas. Yep. But there are, I feel like lots of herbs that support progesterone.
Okay.
Yeah.
I know. I like to just give people like,
Sure.
the, like what's the
do it.
thing? Cause when listeners, they're like, what can I do right now? Like, what can I go buy? What can I, be breathing more, like deep breaths, that helps like gut health, like as an example, it's like as much information as I can give them. Cause even right now, this next one, it says folic acid gene mutation help. What is that?
Is she meaning the MTHFR gene?
I don't know.
I bet she is.
That one I kept on here because I was like, I'm not even sure.
That methyltetrahydrofolate reductase is MTHFR. It's a genetic mutation that doesn't allow you to methylate your vitamins. It doesn't pull off the methylation or the methyl group from the vitamin and give it to other processes.
Okay.
It can slow down, or it can create your follicles to not like mature fast enough or mature well enough. I've also seen this gene impair detoxification of both alcohol, sugars, even like high fructose sugars, as well as impair neurotransmitters that your body uses that methyl group to create serotonin, to create dopamine. And if it can't because you have that MTHFR gene, then taking the active, you'll see on the back of it, it'll say like methylfolate or methylcobalamin are the two biggest ones. Yeah. You can find like trimethylglycine. You can find these methylated products if you have the MTHFR gene that will basically like do it for you. Yeah, and take it off. And then you want to be really careful about if you're buying prenatals in the future, that you're reading the label and you're like, I have this genetic mutation. I need to find one with this. And you can't compromise.
You have to do that. Okay. Because otherwise your body's just not going to be able to use the nutrition.
Exactly.
Ultimately.
You might get, when you're looking at the back of the label and you're like, I want 100% of this dose. Your body's like, well, I can only utilize 25% of it. And either you quadruple amount that you're taking, or you buy the methylated factors so that your body can actually use the stuff that you're giving it.
Yeah. Because don't want to waste the cash. What are you doing? This last one about endometriosis, before we go into premenopause and menopause, it says endobelly. How do I help this? Endometriosis belly.
I bet they're talking about the inflammatory and the inflammatory bloating.
Assume so, yeah.
Back to like the prostaglandin release and like the hormones, the progesterone, anti-inflammatory. That's going to be
anti-inflammatory diet probably too.
Yep.
Ultimately the answer to a lot of these things is the cleanest eating that you possibly can eat. Yeah. I'm sure like lowering your stress levels, all of that is number one. Cortisol,
absolutely.
Yeah. And just like getting your body into normalcy,
Yep. Yeah. And there are supplements like curcumin. You could do high dose fish oils.
Yep.
Looking at that anti-inflammatory effects of supplements, I think I come from the camp of, we don't like conventional medicine because they push pills on us that don't treat a root cause. Who am I to give you a supplement that also doesn't treat the root cause? They're just more expensive. Mm-hmm. We make money off of them. I'm not even going to lie about that.
Of course, yeah.
And so why would I just like green allopathy you, trade out this expensive, supplement for a cheap medication? And like, that's not fair. That's unethical.
Yeah,
and so I like, absolutely, you could do all of these things, but if you're not treating the root cause, you're ultimately just kind of wasting money.
How are you treating the root cause of endometriosis?
By treating the autoimmunity, by treating the hormones, by treating the inflammation, by treating the gut and vaginal microbiome. I actually did an Instagram post on like little known fact. It's not going to come to fruition, but I wanted to write a book on endo.
Oh, why not?
I have a lot of like I have healthcare ambitions for like making integrative medicine very accessible in our community. I feel like that's my mission in this world, is to make this type of medicine available to not just people who can afford it, but for people who can't afford it.
Yeah.
And so it just kind of writing, I should just give the manuscript to someone else. It's not actually a full manuscript. It's like a really heavy outline. I should just give it to someone else to make it come to fruition. I don't think it can be me.
You do all the things. I can't even believe. If you have endometriosis, like please give yourself some love, and also just like go see and do the things and the care that you need to work on that.
Exactly.
It's very difficult, but I can't imagine. And it's hard, but there's not a loss of hope. You know what I mean? There's hope. There's things you can do. There's things you can treat. And it's not an end all be all. So please like remember that,
Exactly.
It's hard to hear all the things, but I believe, and I promise you, if you make the effort, you will feel better.
I also like in one way feel really bad for these types of subspecialties where it's like PCOS, endo, cancer, where there's a lot of people selling snake oil, and there's a huge market because conventional medicine has completely disregarded you and sent you out on your own.
Yeah.
And there are people selling snake oil, selling unverified methods of testing and treatment and doing just really wacky shit in this space.
It scares
and
me.
You're being preyed on. And so of course you're scared to do anything different. Of course you're like, I'm overwhelmed with suggestions because no one's here to guide me, because I'm getting my TikTok. Like that's where I'm getting
literally.
my endo recommendations, because literally everyone is trying to sell you a pill, a tea, a detox, a parasite cleanse. And they don't know you, but they want your money, and you become desperate, and you are being preyed on. And yeah, I just like it really bothers me.
That's why the TikTok stars should not be prescribing you something because they don't know you, not even because they're not unqualified. Like they don't know you. So just like, please look into things before you start doing all these different treatments and things from non-specialists, basically is what I'm saying.
Yep.
Okay. Because I want to get to this. Perimenopause and menopause. Can you just give us a quick rundown of the two? We're going to talk about them kind of simultaneous because they are interconnected, obviously. Age that we should get them, or, generally speaking, we go through these things. I had a lot of write-ins about this. So
this is amazing because we went through all of like the beginning stages of hormones. Now we're kind of getting the tail end. Perimenopause is that shift. So if we're looking at this beautiful 28-day symphony of rise and fall of progesterone over time, you're ovulating on a consistent basis. Everything has gone. I won't say that it's gone well, but like that it's gone. Yeah. At a period of time, your body is going to say, we're not going to ovulate anymore. We don't want to do it. We're shutting that down. Here we go. And that is perimenopause. That is when that brain to ovarian axis starts to slow down. It starts to tell your ovaries to slow down production of follicles. It tells your ovaries to slow down production of hormones. And then when you might still be ovulating every 28 days, and that's perfectly fine, but your hormone production might be less. And so you might be starting to notice signs and symptoms of PMS, or you might be getting like adult hormonal acne, and you're like, where did this come from? I didn't have this all in my entire life, and now I have it. It's because your hormones are changing. And I actually describe perimenopause as like a toddler on a dimmer switch, because the trajectory of perimenopause is always towards menopause, where the hormones are going from high to low, or undetected, or not, or being created as high. But during the process, your body is going up, down, up, down, up, down, up, down. Someone's literally at a dimmer switch, just like cranking it back and forth. And it can be so random. Some months you can go like 3-5 months and it's like, oh, this is back to normal. I wonder what that random month was. And then it's like 3 months of nonstop bleeding, or 3 months of like crazy PMS, or like really bad irritability, or really bad insomnia.
I've heard weight gain too happens.
Oh yeah, weight gain. And they're finding that women's hormone production can actually start declining and changing even as early as 35.
Wow.
Yeah.
Wow. That's early.
I would say that probably like you and I we anticipated perimenopause and menopause to be like our mother's thing, right? Yeah. Like they needed to be in their 50s and 60s. Mm-hmm. And we're finding, women as young as 35 starting to make that change through perimenopause. I would say more commonly in my practice, I see women in their like mid to late 40s really starting to like have concerns over those stuff, and they come in for help. And so then you're this toddler at a dimmer switch. It's going up, down, going nuts. And then eventually your period stops. And when it stops for a consecutive 12 months and doesn't come back, if it comes back at month 11, you restart your clock. Once it's 12 months without anything, you are considered menopausal.
That is, I didn't even know any of that.
Oh.
And that's scary.
Yep.
Because it's something that is inevitable for any woman.
Yeah.
It will happen. We will come to that hormonal change. What navigating it? Tips. Because, is there anything that we can do to make the symptoms less intense, to avoid that weight gain and weight stay? Because I work in the fitness industry, I hear this a lot from my people that are coming to my class. Like, I'm going through perimenopause or menopause and I'm, dealing with this weight gain, or I'm dealing with this, I can't get this stubborn weight off, or I don't feel good,
Yep.
these types of things.
I think one part of it is going to be addressing the effects that your hormone has on the rest of your body. Is how does my female hormones affect my cortisol? How does my female hormones affect my thyroid? How does my female hormones affect, my bowel movements? And so really one part of it is you're kind of like, if we're playing whack-a-mole, you're just kind of like chasing the moles and you're like pushing them down. I think on the other side, you're really addressing the hormones. And one thing that I will just flat out say women have been lied to is the helpfulness and the efficacy and of hormone replacement therapy. And
really?
Yes, absolutely.
Can you elaborate on that? I'm like so curious.
Yes. So it was, I think, one of the worst things to ever happen to women's health.
Oh, this is terrible. I hate hearing this.
In a whole generation is that there was some studies that came out in the early 2000s that basically showed that hormone replacement therapy was causing cancers, strokes, all sorts of adverse cardiovascular health events, a lot. That it was this massive, blow up, and that if you were on hormone replacement therapy, you were basically going to kill your patient in a year. And retrospectively, now what they have found is the original form of hormone replacement therapy is a conjugated equine estrogen. Do you know what the word equine means? No. Horse. Literally, they had pregnant horses peeing into jars and they were taking horse estrogen and making it into a fucking pill for humans.
What?
Yes.
Why? What? Huh?
Your guess is as good as mine.
I know, I'm like, what the hell?
Yeah. And so that form of estrogen was absolutely increasing the adverse effects. And
absolutely it would. It's not for a human.
It's not for a human. And also, do you know how large horses are? And do you know
large.
how large you are?
No, I don't want to get
Can
even
you
near one.
Imagine the size of a horse's estrogen and the size of a human estrogen, and just like the biocompatibility of a horse and a human.
Yeah, no, not happening.
And so after that study came out in like 2002, there was a 63% reduction in HRT prescribing. And basically women were told, you have hot flashes, you have insomnia, your vagina is so dry that it's tearing, but you'd rather not die from cancer and heart disease, right? So sorry. And they actually had a study that came out, or a survey that came out. They surveyed women in that time frame and was like, what do you feel? And people are like, we're scared of it. We are scared. The media made women scared of HRT. And since then, since 2002, there have been huge advances in what we're giving women for HRT, how we're dosing that HRT, who is a good candidate for HRT. And I think what we have learned and what we are finding is that HRT prescribing is more of an art form than a science. And now in 2023, the NAEM and like the women's health, everyone has come out in full agreement that HRT for women, almost as soon as you can start it, or as soon as you personally prefer to start it, basically helps your health outcomes later in life. And you absolutely have no reason to ever come off of it if you don't want to.
So all those people had no chance at getting this help. That sucks. That's horrible to hear.
And I would say in our clinic, we definitely, there is a spectrum of things you can do for perimenopause and menopause. If you are philosophically or medically, you just don't want to do HRT, there are other options. Yeah. I will say, in my opinion, I do think HRT has a whole host of pros that the natural stuff just doesn't have, like the brain protection and the bone protection, where I know that the herbs and the other things are going to be immensely helpful for your symptom picture, and they're going to make you feel really good, and they're going to definitely help with that. But I don't see them doing the same in terms of like osteoporosis protection and like dementia protection and things like that. So I am a huge proponent of the herbs. And quite honestly, back to the informed consent aspect, you just tell people, what do you want to do? Do you want to do phytoestrogenic foods? We can do flax seeds. We can do chia seeds. We can do like really good quality soy-based foods. And you can do the whole like you can do food, or you can, let's talk about the whole spectrum. You can do HRT, whatever you want to do, we can do, but you just need to know your options.
Man, I just hate hearing that, because we're already at such a disadvantage with information as women. And then a disadvantage for information as people who have to go through perimenopause and menopause. And now, you know, knowing that that whole group of women went through all of that, that's just, I hate hearing that. It makes me sick. Someone wrote in asking about, where is it? I'm trying to find it. Pellet therapy.
Yeah.
For menopause.
Yeah. So in the HRT world, there's several different ways to get hormone replacement therapy. There are creams and troches, which are like little dissolvable things that you put in your mouth, under your tongue. You can do injectables, especially for something like testosterone.
Mm-hmm. I've heard of that through. Yeah.
You can do all sorts of different methods. Pellets is just another method to get it. I think, like, I'm going to get in so much trouble. I think that, and here I go, just saying it anyways.
You're like, why not? Fuck it.
Fuck it. I think that med spas have made pellet therapy illegitimate, because you'll walk in and they'll be like, I'm going to balance your hormones for you. They're going to run an estrogen, progesterone. They're going to be like, you need a pellet. Here's your pellet, and hop out the door. And that's not hormone balancing. So I think pellet therapy has gotten a really bad rap for being like a scam and just like a profit center, and like it doesn't. And so in my eyes, pellet therapy is just another tool that you have in your toolbox. It helps with compliance because you only have to get one every 3 months. Actually, we don't even do pellet therapy at MIMC until like we're adding it on in Q4, but it's been 7 years and I've never added it until,
because it's not your number one choice.
It's not my number one choice. There are very affordable, especially for women that have vasomotor symptoms, which is like the hot flashes, night sweats, insomnia. It can be really well covered by your insurance. I've seen people get an estrogen patch for as low as $5 a month.
Oh my God.
Yeah.
So there's just maybe
and
more affordable, better options
and
out there.
It's your personal preference too.
Yeah, but you get to decide, right?
Yes, because a pellet you put it into your butt. Like it's a surgical incision. Yeah, you put it into the skin, right in the fat tissue.
Oh, wow.
And so it's a procedure where that's not a scary procedure, but it, like, you can do a cream, and I think one pro of the creams and the troches and all of those things is you get to practice the art form. Mm-hmm. You really get to listen to your patient. And when I said toddler at a dimmer switch, it's like, my estrogen feels great right now. And you'll get an email a month later. It's like, what happened to me? And it's like, oh, though, thank you for telling me your symptoms. How about you take 1.5? Or how about you cut that in half? Or how about you take it this way?
So you can adjust.
You can adjust. Yes, it's customizable. Where sometimes a pellet is not as customizable, because once it's in you, it just dissolves over 3 months. And
then you're in for another one. You don't even know what your symptoms maybe were.
So.
Okay. Question here. This one's about perimenopause. It says, can veganism cause premature perimenopause? Sounds like they were a vegan for 10 plus years.
I would say I don't know. It's probably, I've never explored veganism as like a professional. I know that there are people who are like, this is the way to go. They are diehard. There's people diehard about carnivore. There's people diehard about everything. So
I think anything in moderation, you're going to be good. Yeah. That's how I live and how I suggest, because it's very hard to get your enough correct protein type in with being vegan.
I would say my biggest qualm with veganism is that people become carbitarians.
Yeah.
They just eat carbs 24/7.
People forget veggies are carbs.
Exactly. And when I say like eating enough carbs, it's all about balance. You should be looking at the percentages of macros that you have and keeping them all in check, but without a significant source of protein that's easily to get. It's high, it's protein dense in a very small amount. It can be really hard to keep your protein percentage in check.
I agree. I talk about that every day at work. I'm like, oh goodness. I don't want to sway anybody one way or the other, but seriously, I just think it would be very, very difficult to live that way. This other question says, is it possible to go through menopause at 26? I have all the symptoms as my mom, who is also going through it right now. Help.
We don't call that menopause. We call that premature ovarian insufficiency. And so it's actually, if you are displaying signs and symptoms of perimenopause before the age of 40 and your lab values are starting to change, your FSH, your LH are starting to rise, you're getting the hot flashes and night sweats and your estrogen and progesterone levels are plummeting, we typically call that premature ovarian insufficiency or early onset perimenopause, early onset menopause. That is for sure something that you need to go in and talk to someone about.
You know, I used to suffer from severe heat flashes, like bad.
Yeah.
And they've gone away completely. Like I'm actually way more healthy and balanced than I've ever been in my whole entire life. So I think that's why. But I used to have heat flashes incessantly.
I would say
incessantly.
And I called them vasomotor symptoms because they can be caused by other things. They're just because they do get lumped into the perimenopause, menopause talk, they're not just exclusive to them. So it could be something else. But if you're like, I look the same as my mom does and I'm, 2 decades younger than her,
I need to go in.
I'd get checked out. Yeah. Get my hormones done immediately.
Okay. Good to know. Okay. So wrapping kind of this part, I really like this question. I want, because I mean, there's so many things about menopause that I don't know. Like, and I know that a lot of people are around their moms right now that are having it, or maybe their sister, their aunt, or whatever it is. How can I support this person in my life, like my mom, with their experience with menopause?
Yeah, I would say it's going to be person to person dependent and asking them really what they need. Yeah. I think being a confidant and listening is going to be really huge because their body is changing in such unpredictable ways that they've never been through it. Yeah. I've often heard it like described as you are another person living in your body and you have you're getting to know this new person that's living there.
That's so hard.
And so really, I think being an emotional shoulder for them, because really outside of like treating with, a qualified medical professional, there's not much you can do except for bring them a fan when they're having a hot flash, give them a huge hug when they're feeling, stressed and not sleeping well, really just being a good emotional support partner.
It'd be so freaking hard. And we're all going to go through it. And we need to keep talking about it. I think that's another thing.
100% we need to keep talking about it.
Bring it up, asking questions, talking about it, that's
what I love about these Gen Zers is they're talking and they're going to bring it. They are going to bring it.
They're going to be like, no, we're talking about this and we're going through it and it sucks booty, but we're all going to go through it and we got to figure it out together. And here's how to make it better. Any last things that someone should know about perimenopause or menopause, the support, the supplements or navigation, anything else that you want to add about that time of life?
I have one big soapbox and I will keep it brief.
Okay.
Birth control is not hormone replacement therapy. I don't give a shit who told you that or what doctor tried to convince you of it. Birth control is not hormone replacement therapy. So if you go to your doctor and you say, I'm having hot flashes, night sweats, I would like to try hormone replacement therapy. And they say, here is a birth control pill. Here is a NuvaRing. Here is some form of contraceptive that you could have taken when you were younger. Walk away. Do not do that because that is not hormone replacement therapy. And it really bothers me because birth control has completely separate risks than hormone replacement therapy does.
Right.
With birth control, you get the high risk of blood clots, especially if you travel a lot. You can have that increased blood viscosity, increased risk of deep vein thrombosis, of pulmonary embolisms, where HRT is protective.
Yeah.
Birth control is not that. And so if you are being offered birth control as a form of HRT, kick them in the shin and walk away because that
say, bitch, and then middle finger and then get out of there.
It really just it irks me to listen to people's stories and they're like, oh yeah, I'm on the Yaz for my, and it will probably help you. Like you will take it and you will probably feel better because remember I said your hormones are raging. They're going up and down, up and down. And remember, birth control suppresses hormonal production. And so it's going to make you feel even keeled. It is not HRT. It does not give you the same osteoporosis benefits or protection benefits. It does not give you the same dementia protection benefits. It does not give you the same heart health protection benefits as HRT does. Walk away.
You got to be given the right things. You have to be, for the period of life that you're in, be doing the things that will support you for that thing, not covering it up.
Exactly.
And I think that's why, I mean, even the people listening right now, that's why they're listening, is because they don't want to cover anything up, but they don't have, we don't have doctorate degrees. So we're just going to keep informing, keep paying attention. If something is like a little questionable and you're like, ask another person, ask a different professional, because if your gut is catching that it's a little weird, it's probably a little weird.
Yep.
You know what I'm saying?
Exactly. Women's intuition is unmatched.
Trust me. I've known things before. I've known things. It's been bizarre. Yeah.
You told me you were having deja vu today, and I was like, oh, I wonder what kind of gift she has.
I know. Oh, I got some weird things going on here. People know too. I had a medium on, and the lady looked at me and she's like, you don't need me to talk to your grandma, and you know that. And I was like, mic drop. I'm scared.
Oh my God.
And I kind of knew that too, but I kind of pretend like I don't know it, if that makes any sense. Anywho, we won't go down that rabbit hole. Okay. We answered this in the previous question, but how can someone go about finding a naturopathic doctor or somebody in integrative medicine? Just because I know we mentioned it in part one, but people probably maybe came from a different episode. So
similar to what you're probably experiencing with other medical professionals, is it's very like state dependent licensure. So really your location is going to dictate who you can see, because the doctor can't really probably practice in the state where you are. Like I'm only licensed in the state of Minnesota. I can't see anyone outside of the state. And so, your best bet is going to be to look for your state association for naturopathic doctors. In Minnesota, we have the MNAMP, mnamp.org. And so you can find the directory, you can see where we're all located, and then you're going to really like filter your intuition through that person. And you're going to say, who do I vibe with? Who do I like? Who do I want to go see? If you're not in the state of Minnesota, trying to find your state association, but also we have a national association. Okay. It's called the American Association of Naturopathic Physicians. You can't type in MNANP because that's also the American Association of Nurse Practitioners. So
dang it.
I know we get naturopathic.org, I think is the website. And
okay, perfect.
And then I would also say that I love naturopathic doctors. I'm just like, I think we got a really amazing education of that best blend of conventional and holistic put together. But there are so many amazing conventional providers who have really jumped ship from the system, want to make a difference, who want to get out there. We have nurse practitioners who are in our office who I'm obsessed with. They are basically naturopathic doctors in an NP degree. And I know that a lot of those types of practitioners will get IFM certified, Institute for Functional Medicine. I have my own beef with that, but with IFM in general, not with nurse practitioners, but they will go. So IFM does have a directory as well. You can find them.
Okay, perfect. This has been awesome. 2 episodes down, back-to-back days, because we couldn't help ourselves with all the questions that were rolling in.
I feel like we should order dinner at this point.
I know. I'm like, might as well just put our feet up and then plan our event. Okay, cool. Thank you for everything. You're phenomenal. Dr. Wild, if you forgot and you didn't hear it in the beginning. You're full of knowledge and it's crazy. I love learning from you. So this is very exciting. And I hope we helped a lot of people.
I hope so too.
And pass this along to your mom, pass this along to your aunt, whoever it is that may be going through this or in that stage of life, we just know we hear you and we see you, and we want to pass this message along to as many people as we possibly can. So truly,
absolutely,
keep passing it along. As always, you can find me at Well Said Podcasts and at Well Said Sid. That's me. I am actually going to Minneapolis Integrative. I think I have an appointment coming up soon. I got to get my shit figured out, as you heard earlier. And if you did not write in for advice, I'm 612-470-7569. You can always call me. Leave me a message if you want to. Write in if you want to. There's links in my bio. You know where to find me. But we're going to continue spreading the word for good health and giving people access to information. Where can they find you?
You can find us predominantly on Instagram. We are MPLS Integrative MC. We use that as our, platform to really just keep educating and keep pushing and disseminating. Like there's a different way of thinking about things.
Yes.
And it can be outside the box. It can be creative. And then you can also find us on our website, mplsimc.com. You can call us if you want to, but I don't know, DM us. It's fun.
Call them, beep them. You know what I mean? I like the DM too. Yeah.
Yeah.
I mean, I get a lot of DMs, so I have to be careful if I say I like to DM. I'm like, I see you. I just might take me a little while, Thank you again for being here. This is an awesome episode. I'm like jazzed to get this out to people. I'm like, oh my God. Appreciate you all. Love you all. And we will talk very, very soon. Bye.